So today I'm going to answer a question that I am asked more or less every single day of my life, and that is, how do we decrease our chances of getting cancer or of a relapse? Now, however simple this might sound, it really is the best that you can do. Obviously, in conjunction with your screening, you're doing your self breast examinations, you're doing your pre-screen cancer screening tests, your medical tests every year, your pap smear, so on and so forth. But what is it that you can do with your lifestyle to decrease your chances of relapse or prevent cancer in any way? Now, really getting into it, I say this all the time: food really is medicine. What you ingest into your system is so critical. I am not saying to be extreme, to be a full-fledged vegan who's gluten-free, doesn't touch any type of sweets or dairy or so on and so forth. But it's all about balance and moderation, which I have spoken about in one of my earlier videos. However, the food that you eat for your system, we call it functional foods, that is specific in building your immune system, is key. Stick to regional grains, stick to food that you have grown up on in your local area, your local grains, local vegetables, seasonal fruits and vegetables. Wholesome home-cooked food is very important. Keep the basic stuffs like fatty foods, sugar, dairy, meat, all that in moderation. But just stick to food that is good for your body. Keep it local, keep it simple. The other thing is definitely keeping your physical activity in check. Making sure that you're doing some kind of physical activity every day, most days of the week. Obviously, managing your mind, stress levels, and things like that. Now, in terms of decreasing your chances of relapse, what most people believe is that they can do their medical treatment, which crashes their immune system, and then think that they can go back to their lifestyle that they had earlier and that they're completely cured of the disease and they're going to be perfectly fine. And then suddenly, soon to realize that there has been a relapse, whether a couple of months later, a couple of years later, whatever that might be. That's because, and it's basic knowledge, your immunity is that one system that protects you from any illnesses, pathogens, external, internal, whatever that might be, but it's what keeps you healthy. Now, it's a catch-22 because when you get something like cancer, you require medical treatment and medical intervention and sometimes extensive amounts of chemotherapy, which can be toxic to the body and also affects your immunity to a great extent, hence the side effects like losing your hair, nausea, fatigue, so on and so forth. So what happens is you already have a chronically low immune system when you are diagnosed with cancer, and then you go do chemotherapy or radiation or surgery, which suppresses your immunity even further, and then when you come out of this, you go back to whatever lifestyle you were living before, which was leading to the suppressed immunity. So there is no way of you building your immune system again, and so again the system starts, and whether there are circulating cancer cells in the body that medical science couldn't pick up, has a room to grow once again, and hence there is relapse. That's why we cannot stress more on the importance of changing your lifestyle and protecting your immune system during treatment so we can deal with the collateral damage that the treatment is doing, and then post-treatment, and that is all about building the immune system once again. It's all about using the right types of food, physical detoxification, mental and emotional well-being to put your system into the best possible condition to rebuild and create a really strong immune system. Now, a couple of things that you can do apart from obviously food, physical rehab, all of that, is also the environment that you live in. We live in a really toxic environment. So the air that we breathe, believe it or not, is something that really affects the immune system. So be mindful of that. The toxins in your home, this might sound too extreme, but cosmetic products, it's full of toxins. So go organic or go, natural as you possibly can. It might be a little more expensive, but really honestly, there's no price for health. And things like even shampoos and conditioners, this is stuff that is going into your scalp, this is directly going into your system. Again, creams that you use on your skin, that is, your skin is your largest organ. It is, they say, the first line of defense. And if we are putting a lot of cream and substances on it that is full of chemicals, it's all being absorbed into the system. And what do we require for cancer to be eradicated from the system and remain out of the system or not grow again, is by actually detoxifying the system, by emitting all the toxins that have been accumulated in the system. So we need to be very mindful of not allowing any more toxins into the body and detoxifying whatever has been accumulated. So your digestive system is, wow, one of the most important systems again in your body. Your gut really does tell you what's going on, and we often ignore the importance of this. I'm going to do a completely different video just on your digestive system. It is so imperative to have a strong circulatory system and a digestive system that keeps detoxifying, because it is a way of detoxification. Sweating is another way of detoxification. So, using perspirants and antiperspirants under your armpits and things like that is blocking the lymphatic system. So, I don't want to sit here and say that, go completely natural, organic, be extreme, sit in your house and don't step out and so on and so forth. All I'm saying is be mindful. And key is to recognize the importance that immunity has crashed even further after treatment, and why it is so important to change the lifestyle, build your immune system, maintain it during treatment as much as you can so we can deal with collateral damage, and then start rebuilding it once the treatment is done. And this is really done through the simple ways of functional foods, of physical detoxification and rehabilitation, of emotional and mental well-being. However simple this sounds, this is the answer. This is the way that people have kept themselves healthy after even stage 4 cancers. I have met hundreds of patients and people who have been written off by doctors and medical treatment and said that there's no way out, and they have completely changed their lifestyles and are healing and thriving today. So this is the way forward, and this is what I follow with all my patients and with my family and with myself.